Hello and welcome once again aboard JulieCity. How are you keeping? I hope you're keeping well and safe. As usual, I'm always excited to be here and I'm glad you are here. Thank you for clicking to watch today's video. You're highly appreciated. So we continue on our pregnancy care series. In my last video, I did cover Placenta Previa. And I got a really educative contribution in the comment section. Based on that contribution, I will be making this video. And this video will be covering Placenta Previa and IVF or assisted fertility or conception. Are you ready? Let's get started. Have you subscribed? If you've not, what are you waiting for? Please click on that subscribe button and the notification bell. That way you don't miss a thing when I upload. Remember, your comments can be a learning point for every one of us, so leave your comments. Now, get your cup of tea, water, juice, whatever it is that makes you comfortable. Let's get started. So, in my last video on Placenta Previa, we did establish the function of the placenta, knowing that it's the powerhouse of every pregnancy, as it provides all the necessary nutrients, oxygen, and access for the baby while the baby is developing in the womb. As usual, all grammars and medical terminologies will be kept as minimal as possible in this video. And in order not to allow this video to be too lengthy, I will encourage you to watch that video. Link I'll be leaving at the end of this video on the end screen and on the card, and also in the description box. I will encourage you to click to watch in order to either refresh or come abreast with this discussion on Placenta Previa. So, one thing we did establish is the fact that Placenta Previa has to do with the location of the placenta during pregnancy. And we also established the fact that the location of the placenta can change depending on the time of pregnancy. It might start somewhere in the lower parts of the womb or uterus, and as time goes on in the pregnancy towards the 33 weeks, it could now relocate itself properly away from blocking the access to the vagina for birth. That was established. However, we understand that Placenta Previa definitely means that the placenta is blocking or causing an obstruction in the cervix, which is the access passage through the vagina for safe vaginal delivery. Having said that, I also did explain in that video, which I will also encourage you to please watch. I gave some of the reasons that can lead to Placenta Previa. However, assisted fertility or assisted conception in form of IVF can also increase the chances of Placenta Previa. I will always reiterate in my videos that they are not meant to scare you, rather to give you the information that you require to be empowered enough to make your decision if decision time arises concerning this. So, I have gone through a few research and evidence shows that probably based on the method, the mechanical method in which IVF is conducted, the embryo or the baby starts by being developed outside and then transferred into the womb for further progress. So as a result of that mechanical development, the chances for Placenta Previa in IVF pregnancies, research says, is higher. I want to also state again, please don't be anxious if you're going through an IVF procedure or you're planning to go through IVF procedure. Don't be discouraged. It is a high risk, not a definite. There's no absolute that because one went through an IVF, they will have Placenta Previa. So please don't fret. Research is based on possibilities and probabilities. So there is a higher chance for those who go through IVF to experience Placenta Previa, not definite. Having said that, it is also important to establish the fact that apart from the dynamics of IVF, research is tilting in terms of why Placenta Previa is higher in IVF. Other reasons for placenta previa, as research has established, is maternal age. Yeah. Again, I would say if you're on the high side of age, in terms of in the late 30s, 40s, please, and even 50, please still don't be discouraged. Let your doctor manage your case specifically. I'll also reiterate that one has placenta previa is not the end of the world. The most important thing is to be well informed in order to make the necessary decisions when the need arises. So it's not a death sentence at all. There are options, safe options. It's just early detection is key. I'll put them on the screen for you. Smoking during pregnancy, use of illicit drugs during pregnancy, all might increase the chances of placenta previa. Multiple pregnancies, whether IVF or normal conception, say like twins or quadruplets, the higher the number of babies in a particular pregnancy, the higher the chance of placenta previa. Now, like I said previously, placenta previa can be effectively managed with close monitoring. So your part is to get informed so you can make the decisions that are required at the right time and engage in your antenatal care throughout your pregnancy. An ultrasound is what will confirm placenta previa, and if another is required later in pregnancy, another one will be organized by your doctor or midwife according to where you are located. So please engage in your antenatal care and get informed. Some of the results of placenta previa could be bleeding, which might be one of the early signs of placenta previa. Prematurity, meaning that because of the location of the placenta, there might be need to deliver the baby early, or it might lead to other complications or special circumstances like placenta abruption, which we are going to be covering in a subsequent video, which might mean that an emergency cesarean section will be required in order to safely deliver baby and also keep mother alive. Again, I say it is important to engage in your antenatal care. It is important to engage in your antenatal care in order to carry your pregnancy safely and deliver safely just as you intended. Placenta previa can also increase the chances for other complications, like I said, like heavy bleeding, which if not managed can be very fatal. So please look after yourself by getting informed and engaging in your antenatal care, getting information that is required for you to make an informed choice at the right time. I hope we have covered the issue of placenta previa. It still does not stop you from asking your questions and making contributions. Highly welcome. That is what the comment section is for, and I will highly appreciate it. Till I see you next time, don't forget, your health is your wealth. Remember to like this video if you found it useful, leave your comments, share this video, subscribe if you have not. Until I see you next time, bye-bye. And if you've enjoyed this video and you found it insightful, please leave a thumbs up for me. That way, the algorithm understands the usefulness of this video and pushes it out to others. Now,